The Chaya Blue Dolphin Balloon Percutaneous Tracheostomy Introducer is designed and intended for controlled insertion of a tracheostomy tube into a patient's airway. First, the patient's airway pressures, exhaled tidal volumes, and continuous pulse oximetry readings are monitored to ensure adequate ventilation prior to patient positioning. Placement of a towel or pillow under the shoulders allows for full extension of the head and neck. The head of the patient's bed can be elevated 20 to 30 degrees. If possible, a screening ultrasound of the neck can be performed, which may help identify aberrant vessels that may be within the predicted path of the tracheostomy tube. Next, the anterior neck is prepped and draped as necessary. The Cook inflation device is filled with sterile saline and then purged to remove all air from the device and tubing. The clinician palpates landmark structures to properly identify the location of the intended tracheostomy tube placement. This is ideally between the first and second or the second and third tracheal cartilages. After locating the desired tracheostomy tube site, local anesthesia is injected into the desired site. A 2 cm vertical or horizontal skin incision is made over the intended site of the tracheostomy tube placement. Blunt dissection can be performed using a hemostat. Following the skin incision, an introducer needle or FEP sheath needle mounted on a partially fluid-filled syringe punctures the trachea. The needle stick should be made at the level between the first and second or between the second and third tracheal cartilages. When advancing the needle forward, verification of the entrance into the tracheal lumen can be achieved by aspiration, resulting in air bubble return. Following the removal of the syringe and needle if FEP sheath is used, a wire guide is introduced several centimeters through the FEP sheath or introducer needle and into the trachea. Next, the FEP sheath or introducer needle is removed from the site while maintaining the wire guide position within the tracheal lumen. The 14 French introducer dilator is introduced over the wire guide using a slight twisting motion to dilate the initial access site while maintaining the wire guide position. The 14 French dilator is removed while maintaining the wire guide position with its skin level marker. After generously lubricating the balloon catheter, the tracheostomy tube is loaded onto the loading dilator. The Cook inflation device is attached to the balloon port on the balloon catheter assembly, and care is taken to ensure no air entered the device before connection. The fully deflated balloon catheter and tracheostomy tube are advanced as a unit over the wire guide while maintaining the position of the distal wire guide marking at skin level. The proximal end of the balloon catheter is aligned at the mark on the proximal portion of the wire guide. This will ensure the distal end of the balloon catheter is correctly aligned on the wire guide, preventing possible trauma to the posterior tracheal wall during subsequent manipulations. The deflated balloon catheter assembly with the wire guide advances until the balloon reaches halfway into the trachea. The black mark on the balloon indicates the midpoint of the balloon. The visual reference and positioning relationships are maintained, and the balloon is inflated. The lock lever on the Cook inflation device is slid to the left to disengage it and to allow free movement of the plunger. The balloon is inflated firmly, and then the lock lever is slid back to the right to engage. This will maintain the pressure and allow higher inflation pressures to be reached. Clockwise rotation of the palm grip on the inflation device is performed until the desired maximum pressure of 11 atmospheres is reached. The inflation pressure is held for 5 to 10 seconds, which allows appropriate dilation for the tracheostomy tube passage. After adequate dilation, the balloon is deflated, and the balloon catheter, loading dilator, tracheostomy tube, and wire guide assembly are advanced as a unit, perpendicular to the axis of the trachea. With the tracheostomy tube in place, the balloon catheter, loading dilator, and wire guide assembly are removed, an inner cannula is inserted, and the circuit is attached. Sutures can then be used to secure the tube in place, completing the procedure.